Hi, this is Alan from Florence Darlington Tech. I'm here to demonstrate how to suction a patient with a trach. And today we have a patient here who has a trach and a trach collar on, oxygen set at 30% oxygen. And I also have an ambu bag that's in the room, which is always a very good idea to have, especially when a patient has an artificial airway. But we want to make sure that this ambu bag is operational. I want to make sure that I have a mask in case the artificial airway becomes dislodged, and I want to check the ambu bag to make sure that it's functional. Include, I noticed that I have resistance, and also when I squeeze the ambu bag, it inflates very readily. I'm going to make sure that my oxygen source is set at least 10 liters per minute or more, and then this is what I'm going to use to hyperoxygenate and hyperventilate my patient. Next I'm going to do is I'm going to check my suction source. My suction regulator here has 3 different controls: off, full, and regulate. I want to ensure that it's on regulate, and I'm going to occlude the suction tubing with my thumb, and I'm going to ensure that my suction pressure is within the appropriate suction range. For adults, it's negative 100 to negative 120 centimeters of water pressure. Pediatrics, negative 80 to negative 100 centimeters of water pressure. And for babies, negative 60 to negative 80 centimeters of water pressure. Once I've dialed in the appropriate suction pressure, I am prepared to suction my patient. I would do my assessment of my patient, checking heart rate, respiratory rate, SAT, which I have my SAT monitor hooked up to the patient, checking their SATs, their color, and then I'd listen to breath sounds. I would listen to 4 on the front, 2 on the side, lower sides, and then 2 on the back. At this time, I'd make sure that I had my supplies that I need to suction, in which that would be a suction kit and some saline just in case. And of course, you already know that I have my ambu bag. I turn my oxygen up to 100% while I'm setting up to hyperoxygenate my patient, and I'll be monitoring the saturation.